The next question, Chris, what is your relationship between health and environmental quality in the 32nd District?
Oh, this is a bad one. We've been having a water problem in this district, and I'm getting sick and tired of the career politicians, and that's Hilda Solis and David Dreher and Grace Napolitano, and they keep getting reelected, and the water's still crappy, and they say, well, we're working on it, we're working on it. Folks, when I built a job site, I had a contract and a contract date to get it done, not keep having it on there. Well, we'll get that in my next term. Oh, yeah, I'm the we'll get that in I've had it. There's a way to clean that up. It's not any magical science, but they keep dragging it and dragging it and dragging it. And, well, we're working on it. We're working on it. Lip service, folks. And I'm sick of it. You send me to Congress, I'll put my construction management into that, and we'll get that. And guess who's going to clean it up? We're going to create the jobs right there in the district. We're not going to bring some specialty group from New Jersey or Nevada or something. We're going to train the people right here and put them to work. We've got a recession. Here, you guys can help us clean this mess up, and you guys are going to get the paychecks, not someone else. That's what I'm going to do when you elect me for Congress.
Thank you, Chris. Betty?
Sorry, I get excited. San Gabriel Valley has some of the most polluted waters in the United States.
Betty, the mic.
Thank goodness it is being cleaned up. And we do have water treatment plants. But the problem with that is that our water bills are going up by big jumps. And why are they going up by big jumps? Because we are treating our water, and then a year later, the government changes the standards, and we have to change the way we do our water treatment again. So the government really needs to settle on what is the real levels of contaminants that they are willing to accept, and we need to be able to level that off. But more importantly, what is important in this San Gabriel Valley area is that the waters were polluted by the federal government, and our representatives have not been in Washington demanding that the federal government who polluted our waters pay for that water treatment.
Right.
And they should be paying for that treatment when the contracts they have soaked into the soil to pollute our waters. The City of Monterey Park is taking a forefront on that, working together with the San Gabriel Water Quality Authority. I was an alternate representative in that area. And believe me, I am very concerned about water because I grew up on a farm and oftentimes had a dry well. We knew how to conserve water because we had to. So ladies and gentlemen, we can do it, and there is money for it, but we gotta stop the money from going to Microsoft to build a bridge from their parking lot A to cross over the freeway to their own private parking lot B. Thank you.
While you're there, we may as well keep you up there since you're fired up right now. I'm going to give you this next question.
Get him, Betty.
The proposed health reform bill mandated that all insurance must. Okay, we're going to try this again. The proposed health insurance bill mandates that all insurance companies must accept every applicant. Okay, Betty, how would you balance the quality care with discounted medicine?
I don't think it's a matter of balancing quality care with with the discounted medicine. And I have spoken to various doctors, and I know some of the people in the audience were at a healthcare panel in East Los Angeles not too long ago. I think it was only about 2 weeks ago. And the doctors there realize, and this was not just the view of one doctor, but several doctors, and I've also spoken to other doctors. There is a lot of money in the healthcare system now. And with just a little bit of push, we can have quality healthcare plus discounted medication. And the reason why is if we get more into preventative care, if the insurance policies and the attitude of the government that provides medical care would get more into preventative care, you will see more medicines being utilized, therefore you have a quantity which adds to the discount. But because it is preventative care, you will be able to have a higher quality of health care because it is more preventative. So in that regard, you don't give up one for the other. I think it goes hand in hand. And with reference to the insurance companies, they should accept everybody. And a pre-existing condition, there are ways of having the insurance company share the responsibility for that when an insured switches over to another company. There are ways of handling that where it is fair to both insurance companies. After all, the monies were provided by the insurance premiums to take care of his health care if he stayed with one company anyway. Thank you.
Thank you, Betty. Chris, the question again is how would...
I was going to ask that.
Okay. The question is, how would you balance quality care with discounted medicine?
Okay. Well, like he said, they're going to accept everybody with a condition. Well, okay, that sounds good to me in my boat. But no, like I'll give you an example of my wife. She's incontinent, and if some of you don't know what that means, is she can't control her bladder. So she has diapers that she has to wear 24/7. Medicare doesn't provide those for her. The way you balance it out is you get a good relationship with the patient and the doctor. That's the people that take care of each other, not the insurance companies trying to figure out their best rates and how much profit in their bottom line. My wife only needs a very few certain items, and she can't get them because the system says, well, that's not in the program. Well, that's what's wrong with her. Well, that's not in the program. That's part of the problem right off the bat. You give quality service for what they need. Now, as far as the discount, obviously they're providing a bunch of other stuff that no one uses. Well, there's some of the waste right off the bat. The way that it's set up now it just doesn't work. It's wasteful. It doesn't provide. If you had a patient-doctor relationship, I believe Blue Cross, I can't remember, Anthem, they provide, if you're preventative medicine, you prevent it, it costs a lot less to prevent the medicine than to take care of it. How about someone that quits smoking? Well, then they should get a better rate because they actually reduced some of the risks. But they don't have any of those incentives. They don't have any programs set up like that. They just try to push the pills, and the pharmaceuticals are big money, folks, and that's another thing. First thing I'm doing, to hell with those pharmaceutical commercials. What the hell do I need to see those on TV for? I don't need it. And that's money that they're using off of your profits to tell you so you can tell the doctor, hello, the doctor's the one that's supposed to know about the medicines. So I want to try this brand because I saw it on TV. Away with those commercials. You know, freedom of speech and all that, that's fine, but they're wasting their pharmaceutical money to brainwash you on the TV set. We don't have hard liquor. Yes, I'm fed up with the pharmaceuticals in that aspect. The research and development, I understand, but the commercials, they got to go. And like I said, okay, there.
Thank you, Chris.